something we believe is incumbent on us as vendors to provide not just a single use case, but multiple use cases to take them out of the world of point solutions. And, Brenton mentioned change management earlier. Part of change management is the way that you engage with the solution, the way the solution runs behind the scenes, all those different parts and pieces. So if you can engage the clinical team and deliver value across 25, 30 workflows, 100 workflows eventually, you're going to have much more success than trying to have one algorithm that runs in one use case that works in one specific way, even if it all shows up inside the EMR vendor or the imaging vendor, or wherever it is that it should ultimately be consumed, or your own application in certain circumstances. You've got to really drive enough value across the full spectrum to get the adoption. I'm sure Ashley, from what I heard, she loves to implement interfaces. And appreciate every single vendor coming in with their own specific requirements, right?
Well, yeah,
Oh, that's a funny joke.
Yeah, fair question. A fair question, because you probably are seeing the tensions between the technical vendors and the system's needs.
Absolutely. The number of servers to this particular audience member, I can feel your pain when it comes to looking at all the different requirements from different vendors. One of the things that we do as an organization is we really try to partner with, to Dimitri's point, solutions that allow us to have multiple different modules versus having different point-to-point solutions that are one-off, that may have, and I will say this often, their own app, their own communication ability for you to communicate with amongst each other within the app. So every user is able to go into that app and communicate. There's not only risks as it's associated with from a server perspective, but from a medical legal perspective as well. When we are talking about having multiple different avenues for people to communicate with each other, we're also liable for all of that communication. So that's a little bit outside of the realm of this discussion, but we really want to make sure that we have unified communications across our organization, and at least we do at Ochsner. And so it's a risk that we just don't want to take. So we do our best to limit how our clinicians communicate with each other about our patients. So it's not just the number of servers or limiting the number of servers. There are so many other downstream effects associated with that.